Let's look at what actually went on with the vaccine and development of the vaccine. First, we have to remember coronavirus and research around mRNA vaccines has really been out there for decades. In fact, around 40 years now. It started way back in the 1980s. And you have to remember that coronavirus is a big family of viruses that have been around much longer than the last year and a half or 2 years. So this is not a new type of virus. What we're seeing now with COVID-19 is a variant of a long-standing virus that we've known about. So research started in the 80s. It continued in the 90s around with another researcher, and they worked through a lot of the challenges of making some breakthroughs in this field. And it really was in the 2000s that the ability to begin to make synthetic forms were out there. And that really accelerated the research. And I remember well in the 2010s, in the past decade, some diseases that came out. I remember SARS coming out. I worked in our ER here at Trinity when SARS came out, and we watched that globally very closely. It was a fairly scary respiratory disease that was killing people, and luckily it tended to die off and never really affected us here in the United States. But research is going into vaccines around that time. This researcher, Dr. Rossi, was a Canadian bio researcher that actually came to Harvard University over that time. And he, along with Dr. Corbett at Harvard, did a lot of the groundbreaking works which began becoming a reality around these vaccines at that point in time, and really was the groundwork that laid way for a new company to be formed called Moderna. And you know Moderna currently as one of the vaccine makers that is out there. And so all of the trials were gone through in the normal steps. They were actually going on long before the COVID-19 virus came on the scene. And in 2020, success was a reality around COVID-19 vaccines and was out to the public. So the misconception of this vaccine being developed over the year and a half of this virus is really not true. Research dates back almost 40 years on mRNA vaccines and coronavirus vaccines. All of the monitoring for vaccines is in place, and here lists out what's gone on. And actually, at this point in time, the coronavirus COVID-19 vaccine is actually one of the most well-studied vaccines that we have out to date. I touch on a couple things with this. First, huge number of patients have now received 1 or more doses of the vaccines, and in a lot of cases 3 doses of the vaccine at this point in time. And are there side effects or adverse events to vaccines? Of course there are. There are side effects to every medication you take. If you buy a bottle of aspirin, there are rare side effects that happen. With these vaccines, about 5 patients out of a million patients receiving will have anaphylactic type reaction. So, relatively low, 5 out of a million. Thrombosis with thrombocytopenia, about 3 out of a million, and this tends to be a little bit higher in young females. This is with the Janssen vaccine. With Guillain-Barré, about 7 of a million patients will have Guillain-Barré, and when you talk about older males, the incidence is a little bit higher. This is with the Janssen vaccine. With the mRNA vaccines that are out there, myocarditis is a potential side effect. 3.5 people out of a million will have or can get myocarditis. And this actually goes up with younger males, about 25 to 50 out of a million young males can get this from the vaccine. But remember, what we're talking about isn't I'm either taking the vaccine or I'm not. Really what we're talking about is I'm taking the vaccine or I'm taking the disease.